Great.
Yeah, take it away.
Welcome. Let's get started. Thank you very much for joining this parallel session on fit-for-purpose cost evidence. In this session, we're going to talk about the neglected side of development effectiveness research, the cost side. And since cost evidence comes in many forms, we're also going to talk a little bit about some of the considerations that shape researchers' decisions about what data to collect and how to analyze it. We're going to focus primarily on cost effectiveness analysis with an emphasis on the cost side of the equation, though the presentations have general relevance for other types of economic evaluations as well. My name is Douglas Glandon, Lead Evaluation Specialist and Leader of Methods Development at the International Initiative for Impact Evaluation, or 3IE. And it's my privilege to sit virtually alongside these esteemed panelists, including Alaka Holla from World Bank's Strategic Impact Evaluation Fund, or SIEF, Tulloch from the International Rescue Committee, IRC, Anu Dutton from the Abdul Latif Jameel Poverty Action Lab, JPAL, and Sam Fishman from the Center for Effective Global Action, or CEGA. We'll follow a lightning talk format with presentations of about 5 minutes or so each from each of the 5 panelists, followed by time for questions and discussion at the end. I'll introduce each of the other panelists directly before their talk. If you have any questions for any of the panelists as we go, please either type them in the chat or save them for the end, and we'll get to them then. All right. In terms of the agenda, I'll briefly set the stage for the discussion and mention some of the work done by the costing community of practice, which includes all of the organizations represented on this panel. Then Alaka will talk about how program design considerations tied to policy questions drive the cost analyses and cost estimates. Caitlin will talk about comparative cost effectiveness analysis within a particular context to inform policymaker decisions. In this case, integrating cost analysis into a multi-arm impact evaluation of USAID's Pakistan Reading Project. Anu will then take a step back and also shift to a prospective analysis to look at comparative cost effectiveness analysis for scaling and adapting programs across contexts. And then Sam will talk about how cash benchmarking fits into the picture, highlighting some of the important work done to date and offering a glimpse of where the work might be heading. Okay, I'll dive in. This brief summary is about some of the work done by the costing community of practice I just mentioned. That is an organization or a practice community, not an organization, led by CEGA, but also with other representation from other member organizations, including 3IE, IRC, JPAL, IPA, Evidence Actions, ESRF, USAID, MCC. And a disclaimer is that this is not an official representation of the positions or work of any of these organizations. It's the work of the individual representatives who happen to work at these places. Okay, so the title, The State of Cost Effectiveness Evidence Guidance, 10 Best Resources. So what is the guidance out there actually on how to incorporate cost evidence into impact evaluation? That's what we're talking about. The premise is that cost evidence, as you probably know, lags far behind effectiveness evidence. And one study by Brown and Tanner from 2019 estimated that it was around 1 in 5 impact evaluations that actually included cost evidence. And that paper highlighted some contributing factors, including a lack of training in cost data collection analysis, lack of standardization of methods and assumptions, limited demand from peer-reviewed journals, and inconsistent funder requirements. So a variety of reasons. The costing community of practice exists to help address some of these barriers so that the cost part can sort of catch up with the effectiveness part. And the 2 main ways of doing this are as a community of practice normally would, share knowledge, experience, expertise, tools, resources, and so forth to help identify ways that actually can be useful in bringing in cost evidence and how to do it in specific circumstances. And the second part that the costing community of practice thought would be useful is curating resources that are out there that can help researchers, particularly impact evaluators who may be new to bringing in cost evidence into the impact evaluation. So that's what I'm going to highlight very briefly here is a summary of some work recently completed to identify 10 best resources, 10 best. There are many that could be quite good. We need to limit it to 10 to make it digestible. We followed a systematic search and screening of both peer-reviewed and gray literature. We also used crowdsourcing through the costing community of practice and professional networks. And we applied a series of rating criteria based on the practical utility, user-friendliness, generalizability across contexts, and whether or not the access was open or paid of the resources. We identified 10 resources. I won't go through the details of these here, but in the recording you can go back and take a look at the list. One thing that is important to note is that each of these resources has slightly different recommended use cases, varying from some upfront questions in number one to think about which type of evaluation or economic evaluation method might best fit your policy need or question, to number four, designing a cost effectiveness analysis, looking at some of the key methodological details to consider up front, to number five, which is developing a data collection plan, or number six, the actually recording and capturing that cost evidence, and so forth. So you can see we've highlighted the areas of highest relevance and moderate relevance based on a stage of collecting or conducting a cost effectiveness analysis study. So stage one being problem diagnosis, two being design and planning, data collection, analysis and reporting, and then dissemination and knowledge translation. So this could be useful to refer back to. The paper will also be coming out soon. This is a sneak preview. Important gaps remain, including guidance-related gaps. So there's fragmentation of guidance, different types, as you saw, focusing on different pieces, often related to specific sectors or contexts of implementing the work. There's not enough guidance related to the process of how to actually get this done as compared to the theoretical part. There's no repository of vetted cost effectiveness analyses, which would be quite useful. And then there's some other barriers that I mentioned earlier that remain. Few funders actually have requirements to bring cost evidence into impact evaluations, and there often are not strong incentives for authors to publish that information in peer-reviewed journals. But the message is positive. There's an active community of researchers and practitioners working on this, including those here, but also others. There's a growing body of guidance and tools, particularly helping to fill in the prospective cost capture piece. And there's a greater emphasis on cost within some development agencies. So USAID, for instance, recently updated guidelines released earlier this year, requiring that cost analysis be included as part of every impact evaluation. And others are advancing on the front as well. There's increasing attention to the need for cross-sectoral work, and broadly, I think we all believe that better, more frequent reporting of cost, more transparent reporting of cost, will also enhance synthesis work and prospective modeling work. I put this up here for the recording in case you want to go back and look at any of the specific resources that were listed. And that is the end of my presentation. Our next presenter is Alaka Holla. Alaka is a program manager of SIEF, as I mentioned before, a multi-donor trust fund that promotes the use of rigorous evidence to design policies to improve education, health, access to quality water and sanitation, and early childhood development in low and middle income countries. Since she joined World Bank as a young professional in 2009, she has worked in both research and operational settings across a diverse set of country contexts, including as a core team member of the World Development Report 2015. Her research is focused on the quality of service delivery, discrimination, early childhood development and education, and cost analysis. Over to you, Alka.
Thanks so much, Doug. So I will share my screen. Okay, and so can you verbally tell me if you can see my screen?
Yes.
Okay, great. So today I'm going to talk about two concepts that have become very important for the strategic impact evaluation in costing: accuracy and relevance. And this is joint work with Sam and another colleague at the World Bank, Yilin Pan. And so we just require, or we aim for the cost data collected in our impact evaluations that we fund. We want them to be accurate and relevant. So I think we all know what we mean by accuracy in general, which is, we don't want we don't want to kind of under or overestimate costs. On relevance, this is kind of a bit of a new topic, and it's the point of this whole panel, which is kind of fit to purpose evidence. And on relevance, a nice way to think about this is when you're kind of buying a house. When you're buying a house, you want to know the cost of the house. You don't want to know just the cost of the window, and vice versa. When you're repairing your windows, you want a price of the window, not a price of the whole house when you're making your decisions. And so accurate cost data, and I think these are all principles that would be in Doug's top 10 resources. Accurate cost data is disaggregated. It's specific to the intervention that perhaps you're estimating benefits for. It's collected in real time, and it's from multiple sources. So, most studies that do a careful accounting of costs use the ingredients-based method or activity-based costing, and that gets you most of the way. It does not get you collection in real time. We understand that that's kind of pretty hard to set up, but ingredients-based costing gets you most of the way for accuracy. And just to show you kind of how much this can matter, before that, I just want to define relevant cost data. So relevant cost data is tailored to the decision that the user of the cost information needs to make. And just to show you kind of how off one can be in terms of accuracy, I am showing estimates of cost from an impact evaluation that was in the SIEF portfolio that was looking at the impacts of an extra year of preschool in Bangladesh. And Sam collected the data for this. And when he went in, the program had already been under implementation for 1 year. And it was being implemented by an international NGO, a well-respected local NGO implementing it on the ground. And when we went in, the program had already been implemented for 1 year. So we said, okay, great. Can we have your financial records, your budget, so you can tell us what this program costs? And when we did that, we got near $27,000. And of course, once we started unpacking all of these costs and using the ingredients-based method and collecting the data in real time for that next year of the program, the cost of the program shot up to $157,000. So we were, off. If we had used program implementation records, we would be off by a factor of 5. And similarly, in another study that we did in Afghanistan, this was all retrospective. We couldn't get in for real-time data collection. We were estimating the costs of community-based schools. Again, when we looked at the orange dots on the screen represent the estimates of cost we would have if we just relied on implementers' financial records. And then the green dots represent what happens when we start interrogating those records with the ingredients-based methods. And here we see both overestimates of costs if we look at the records and underestimates of costs. And just to kind of very simply see why this is so problematic, it's because when we're looking at when we're doing cost-benefit analysis or cost-effectiveness analysis, we're estimating a ratio. And when something is wrong in the denominator, it's going to mess up that whole ratio. So if we were looking at, for example, a benefit-to-cost ratio and our costs were off by a factor of 5, that would probably change the way we thought about the value for money for that program. So now relevance actually functions the same way. So the same reason why we're worried about accuracy of costs because they're in these ratios, we should also worry about which cost estimates we're using. And so what I want to show you today is that there are different users for different cost estimates. And so I'm going to talk about 4 different cost objects. There's more than 4 of these, but let's just talk about 4 of them and see how they may differ. So one is the full economic costs of the program. So these are costs incurred by all implementers, by beneficiaries. You're doing amortization because some inputs could be used beyond the life of the program. You are looking at present value of costs and benefits, putting them all in the same time period, and you're counting everything that is required to implement the program, like overhead and supervision. Another cost object would be the financial costs for, say, the main implementer. These costs would be specific to that implementer. They wouldn't care about beneficiary costs. They wouldn't do the amortization because possibly they are not going to be using the inputs much longer, and also they need to kind of have the financial resources to purchase them up front. And there is still overhead and supervision. Another object is the implementer's programmatic costs. So these are just like the financial cost, only there isn't overhead, right? So these, you can kind of think of these as the cost once the implementer has decided to do the program and has sent the money to the unit responsible for this program. And then finally, there are costs that we're calling frontline costs. Again, they're specific to the implementer. There's no beneficiary costs, but more importantly, there's no overhead, there's no supervision, there's no monitoring. These are the costs that are just costs of inputs. So for example, on a cash transfer program, it would just be the cash transfer. And it's useful to think who would be using these different cost objects. So the full economic costs is what we're assuming governments and donors and researchers who are doing cost benefit analysis or cost effectiveness analysis, this is what they need, right? So they're basically asking the question, is it worth implementing this program for society? The financial costs for a specific implementer, these are what the implementer needs to know, right? Or the contractor of the implementer. How much do we need to give this implementer for them to implement this program? The implementer's programmatic costs is what mid-management of that implementer needs to know. So there's no overhead that's already been taken off once the money came in. And this is what's being sent to the main unit required to implement the program. And finally, for frontline costs, really kind of overworked program manager or project manager needs to know these costs. These are the people who are purchasing inputs on the ground or hiring people on the ground. And just to show you how different these cost objects can be, I will highlight just a few. So 4 different programs that we have costed at SIEF, we have calculated these different cost objects. So for the Bangladesh preschool program I told you about before, the full economic costs of the program are about $145 per child, and then the frontline costs are about $43 per child. You have kind of smaller differences, for example, local NGOs in Afghanistan. But why am I telling you this? You know that it would be really bad if we presented one of these lower value cost objects as the full economic costs of the program, right? That would really change the value of our ratios when we're trying to estimate the benefit to cost ratio or the effectiveness to cost ratio. And we have seen a tendency in our evaluations, just like there's p-hacking, everyone wants their standard errors to be very low and their impacts to be very high. Everyone also wants their costs to be very low. And so we have people saying, can we only present programmatic costs? And our answer is, yes, if you're making a presentation to mid-management of the implementer, if you're doing a cost-benefit analysis in your paper that's going out to the world, we really want you to present full economic costs. A second thing that complicates relevance is not just, even if you have accuracy down, even if you have your user in mind, the fact that prices vary wildly across countries can also make a cost estimate irrelevant for some countries. And so what I'm showing you here, I think you'll all be familiar with the International Comparison Program. If not the name of the program, you are all familiar with purchasing power parity adjustments or PPP adjustments. This is the data collection program that collects the data to make those adjustments. And what we're doing, they share data with us, and we're graphing here the average teacher salary in low income, lower middle income, and upper middle income countries in international dollars, right? So these are all, this is all the kind of the same purchasing power dollars. And what you will see is even within an income group, you see really, really wide variation in the price of teacher, right? So let's just take, let's go to the lower middle income group where most of our studies are in development economics, and you see kind of a range from $10,000 purchasing power parity adjusted dollars to above $50,000. Likewise, say if you're looking at the price of transportation, because often supervision or anything that requires supervision would require transportation, you see the price of transportation also, or at least the fuel for transportation, varies really widely across countries. And to see why this matters, think of a question that you have in education. Should we hire more staff or more supervision? And suppose you have a bunch of studies from different countries that say, it's more cost effective to do more supervision, to hire more staff. So one thing that we need to ask, we've as a field become good at asking about the external validity of the impact estimates. We also need to ask this about cost estimates. So even if the effects are the same, costs can differ, and we really need to know about the relative costs in these countries. And so just to recap, cost data should be accurate and relevant. Please use the ingredients method. That'll get you accuracy, and ensure for relevance, ensure that you have the right cost object for the right user, and also check the generalizability of prices and relevant prices. Thank you.
Thank you very much, Alaka. Okay, next up we have Tillock. Caitlin is the Associate Director for Best Use of Resources at the IRC, where she leads a team conducting the cost efficiency and effectiveness of humanitarian programs. Since 2015, this team has conducted 10 cost effectiveness analyses and more than 100 cost efficiency studies, and created the Systematic Cost Analysis, or SCAN, software to enable rapid field-based cost studies. Caitlin has served on advisory panels about cost analysis in the humanitarian sector, worked on infrastructure resource allocation with the Public Financial Management Unit of World Bank Indonesia, and spent 4 years at JPAL, where she managed the organization's portfolio of cost effectiveness analyses. She is a co-author of JPAL's paper on a standard methodology of cost effectiveness analysis for development programs, and has published on best practices for using economic evaluations in decision making. Over to you, Caitlin.
Sorry, my unmute button was hidden, but I think you can all hear me now. Great. Well, thank you so much, Alaka, for that really wonderful intro presentation, because I wanted to walk you today through an example of what a cost effectiveness analysis as part of an impact evaluation actually looks like. And I think as Alaka kind of foreshadowed, quite often there's this sense of like, well, it's the cost of the program. Surely that must exist in the financial records. Like, how hard could that be to estimate? I'm over here thinking about, attrition bias. What's the big deal? And I really wanted to walk you through this example from the lens of accuracy and relevance, because even within a case where you don't have to think about these external comparisons across contexts, I'm going to talk about a multi-armed impact evaluation with an associated cost study, there's still quite a lot of decisions to be made that will inform the inferences you can draw. So I'm going to talk today about the Pakistan Reading Project. And this was a very, very large USAID-funded reading program in Pakistan, implemented by the IRC, as well as several other partners, in partnership also with the local government. And it was a literacy program that took a fairly traditional approach, focusing on new pedagogy, curriculum materials, and then a suite of teacher professional development programs or activities, let's say. And these kinds of teacher professional development programs usually include a whole big package of, let's say, materials and training and coaching and so forth. But when they're implemented in that package way, they're also often evaluated. And it's very hard to know what's the contribution of these different activities to cost effectiveness. It's kind of this kitchen sink approach where if we just keep adding things, the impact will go up. But if the cost goes up by more than a proportional amount, we may have actually reduced cost effectiveness. And in particular, we've made it so expensive that it's very hard to roll out widely. So understanding cost effectiveness of each activity in a comparative way is really important. This cost study was implemented alongside an impact evaluation that measured the incremental effectiveness of each piece of a teacher professional development package. And I'm not going to talk a huge amount about the impact estimations here, but what you need to know is that basically there were 3 arms of this study, each of which removed one element of that package. So it was the normal package minus face-to-face training, minus these teacher inquiry groups where teachers would get together with local colleagues and discuss these new practices, or minus this coaching, these school support visits, where a supervisor would come out, observe a teacher in their classroom, and then provide some coaching on how they're incorporating these new literacy materials. So onto that impact evaluation, we added a cost analysis, and the goal was to try and identify the most cost-effective package. I think this gets at one of the first points about kind of relevance and the distinction Alaka made between the window and the house. We're interested in these packages, but what we're really interested in is the separate cost of each of the activities within those packages. That's the question being asked by the government, and so we're going to need to address that in the design of our study. To the point about relevance also, this was a really clean case where the intended user of this evidence was very clear. This was intended to inform the government of Pakistan's decision about which package to ideally scale up and adopt on a sustainable basis. And in particular, we thought that that was likely to happen at the state level. It was going to be state ministries taking forward different parts of this. And so that can help situate us among those 4 kind of squares that were on the screen in the earlier presentation. This is going to be about costs that are going to occur for the state level ministries. Don't care so much about capital city costs and things like that, but they probably do include overhead and supervision and things like that. And we need to make sure that those are included in our estimates. So as I guess was just saying there, we really went about this in a disaggregated and intervention, or in this case, I'll say activity specific way. This was an enormous project, like 5 years, multiple provinces, multiple implementers. Even all of these activities I've just mentioned were part of one objective out of 3 objectives. There was no world in which we could just grab the financial records and identify the costs we cared about from them. And so if we were going to measure these costs accurately, we first needed to be specific about what exactly we were going to measure. We focused on, from the full scope of the project, these specific activities that the state MOEs might take forward. And then geographically, I'm sorry, I should be saying province, not state. Geographically, we focused on the province in which the impact evaluation was done, which is Khyber Pakhtunkhwa. There were multiple cohorts of this program running through. And so again, we focused on the one where the impact evaluation was done and the specific months in which we observed implementation. And one thing that was really cool about this is that the program had already been running for several years at that point. And so this was a pretty good picture of the recurrent costs to keep the program running. But to the point about generalizability of these estimates, that's different than if we were asking the question, what would it cost to pick this program up and start it in a new country? This was the right question for us here, but we needed to be clear that that's not a general picture of the cost to pick this up and start it again. So within that already narrowed scope, we then wanted to get the costs of these specific activities. And there are the 3 parts that were varied in the impact evaluation: face-to-face training, the school support visits, and the teacher inquiry group meetings. But there were also a whole bunch of other costs that were incurred for every school across all the treatment groups, but that we thought were really important foundational pieces for the impact that those 3 experimentally varied activities might have had. And those are the basic reading and learning materials. It's hard to imagine a program, a literacy program that wouldn't have those. Some corner libraries, kind of an extended set of materials, and then these management and operating costs at the district and the provincial level. And so we wanted to estimate the cost of all of these things, but also to be able to identify them separately so that we could understand where costs were coming from, and so that we could look at the variations in costs for the different packages across the arms of our impact evaluation. Also, to Alaka's point, we did this in real time. We actually planned this before the RCT launched, and our practice is to do a full ex-ante analysis using budget and log frame just to figure out what's going to go wrong when we start doing it in real time. This is what flagged for us, for instance, that there were a whole bunch of staff who were going to be splitting their time between these activities we were costing and other activities not in scope. So we needed to introduce time and effort tracking. We also realized that because we wanted to get at the costs of reading and learning materials in Khyber-Pakhtunkhwa specifically, but there were these giant procurement contracts happening for all of the Sindhi materials for the whole country, we couldn't just use the total contract costs as they were going to show up in our accounting data. We needed to get with procurement and get unit costs of specific materials. Finally, then, we use the actual monitoring and expense data to understand the real spending, the real program outputs, and then I'm just kind of giving short shrift to that impact evaluation that was also happening. But all of this was happening the entire period of time that the impact evaluation was running. I really like doing this ex-ante analysis just to figure out what's about to go wrong. So what did we learn? I think this was like 2-ish years of analysis for this one very nice little table. But we ended up costing these per school because that's the level at which most of the costs added up. It was the most logical presentation of results. And you can see the costs for these 6 different activities. The biggest first takeaway that I had was that the costs of this cross-cutting support, this is management and supervision at the district and the province level, it's the one called fixed costs here, was really, really big, way bigger than I expected. And it really, for me, reinforced that if we focus only on those incremental costs, the frontline costs, I think, as Alaka would say, we may be missing a really large component of the program and what it took for the program to be run successfully. And one thing that's really emphasized to me is that if we get overly fixated on just those little incremental frontline costs, we may be missing something that's really important in actually driving impact. And when you think about, we take these programs and then we say, oh, all the management costs will be absorbed by the government, take this, plop it into a system, and then the impact doesn't replicate. I think that the costs may be an important part of that. So this really was a learning experience for me. Looking down then at the activity-specific costs, you can see a pretty wide variation. Face-to-face training is about $100 per school, whereas the school support visits, this is that one-on-one coaching where we send a supervisor out to observe and coach, understandably, perhaps cost almost double that. And that gives us some sense of how much impact we would need to see from these school support visits for them to be a cost-effective addition to the package compared to something like the basic face-to-face training. When you add this together with the impact evaluation results, and I'm not going to give you a regression table here, we're just going to talk about in very rough terms, size of costs and size of impacts. We've got these 3 pieces, these 3 incremental additions to the standard package of teacher professional development stuff, where we can begin then comparing what's the size of the cost for face-to-face training and the size of the impact. Face-to-face training or any of the other activities. So face-to-face training is about $100, positive, small to medium effect. School support visits, although they were more expensive, they had a much larger impact. And actually, they ended up looking like a cost-effective addition. That impact more than outweighed the cost. These teacher inquiry groups, though, for some particular reason, and there's qualitative research going into it, really did not have much impact and may have even had a slightly negative impact on student reading skills. So for $170, we don't need to spend that if it's not having an impact. This gave us some really good insights about what was going to go in the most cost-effective package. Those are our cost-effectiveness results, but I want to kind of stop and say, what inferences did we make? What conclusions did we draw to try and draw a line between here's the ratio and this one is the best versus something that you would really communicate to a decision maker or a policy maker? The first of those things is absolutely this comparative cost effectiveness. This helped us say this is the most cost effective package. It includes all of these elements except the teacher inquiry groups, and that package cost about $1,350 per school when IRC was the implementer. You'll notice, though, that I very clearly said when IRC was the implementer. And even though this was run with the government through ministry schools and all of this, it's worth questioning how much those costs generalize. One of the great things about doing this in this incredibly detailed ingredients-based method is that you can go back and do alternative scenario modeling. And we worked with local staff in Pakistan who knew the government system quite well to go through that fixed cost category and say, we don't want to assume that these all go away. Which of these do we think could be taken in by slack in the government supervision system? And which of them would need to be newly introduced to support this program successfully? That allowed us to come up with a model. It wasn't a direct observation, but it was a much better model than kind of hand waving and hoping our unit costs go down. That the cost for the Ministry of Education to sustain the program would be that program that would cost $1,348 when IRC implemented was more like $790 per school. And so that is a useful figure for planning purposes. And then thirdly, because we can do that kind of modeling, you can also ask a lot more basic questions about budget feasibility. And sometimes I think when we do these cost effectiveness analyses, we lose sight of the fact that there's budget constraints. Cost effectiveness is in some sense a price per unit of impact, but there is still a budget constraint of the dollars you have to spend. And even if it has, the greatest cost effectiveness ratio in the world, if it's $700 per student, that doesn't really matter. So knowing that we have this $790 figure per school and the average number of grade 1 and 2 students, we could do a really simple benchmarking exercise and say, given the number of students, that's about $23 per head. That is not crazy when you look at current per capita spending in the country. And therefore, this is something that we think is the most cost-effective thing to do. We have a sense of the aggregate costs that it might present to the government to carry it forward, and how it would impact the per capita spending to add this to the government's portfolio. So that's really what I wanted to share with you today. I think I'm going to hand over to Anu to talk about the even thornier issues relating to inferences beyond one single province and one single country.
Thank you so much, Caitlin. Okay, next presentation is Anu. It's from Anu. Anu Dutton is a policy manager at JPAL Global, where she manages the health sector. In her role in the policy team, she writes policy publications, cultivates new research partnerships, and conducts policy outreach for evidence dissemination. Prior to her time at JPAL, Anu worked in a number of positions related to health policy and research, including maternal and child nutrition at the Results for Development Institute and communicable diseases and vaccine access at the One campaign. Anu, take it away.
That's great, thanks, Doug. And just to confirm, you all can see my screen, right?
Yes.
Okay, great, thanks. Great, yeah, so I will continue the conversation about comparative cost effectiveness analysis, focusing on comparing the cost effectiveness of different programs that have the same intended outcome. So specifically, I'll highlight important considerations that come up when scaling programs or adapting them across contexts. So just as a starting point, I want to first highlight two types of cost effectiveness analysis that will come up sort of over the course of my presentation. The first is retrospective analysis, which helps to analyze the cost effectiveness of a program after it's already been implemented. So because it's already been implemented, this means you can use actual cost data, you can use actual impact data. Of course, there's a lot of considerations even then, as the panelists before me have highlighted, but this is useful for understanding sort of the actual cost effectiveness of a program as it was implemented. The second type of analysis is prospective analysis, which is really useful for informing planning. And that means we can use data on what we think a program's costs and its impacts will be to predict what its cost effectiveness might be when scaled up or adapted across contexts. So to sort of connect the two, this often involves taking the retrospective analysis and changing some of the assumptions, changing some of the costs to suit the new context or the new scale at which the work is going to be implemented. But as you can imagine, because we're not using actual costs, this adds even more uncertainty. And so I'm going to talk a little bit about some of the different considerations that come up when doing this kind of analysis to inform future planning. So before kind of diving into those considerations, let's take a step back, because at its most basic, right, cost effectiveness is really just a ratio. You're taking the impact of a program and you're dividing it by the costs of that program. And so I think when we think about adapting a program across contexts, we often think about how the impact of it can change. I think that's fairly intuitive. I think an example of this could be deworming, where it's super effective in contexts where worms are a huge issue. But if you were to implement a deworming program in areas where worms aren't as big of an issue, then of course you're not going to see as much of an impact. And you can also imagine the reverse scenario, where if you're taking a program and adapting it to a new context where it's even more effective, then you might see the cost effectiveness increase, assuming, of course, that costs stay the same, which is a huge assumption. And I'm going to dive into that in the next couple of slides. And so, yeah, as I alluded to, the cost is really where I want to focus today, because it's critical to think about how implementation might also vary, might make the costs vary across contexts. So one way in which the cost can change is when you scale a program. So the graph that you can see on the right here highlights programs from Kenya, Malawi, and the Dominican Republic that each aim to increase school attendance. So it shows the cost effectiveness in the pilot phase and then also at scale. And you can see here in these particular instances, the cost effectiveness increased in each of these cases. So in Kenya, for instance, the deworming program that you see highlighted was implemented by an NGO in partnership with the local Ministry of Health. It yielded almost 12 additional years of education per $100 spent in the pilot, which was hugely cost effective. And then when it was scaled, those costs became distributed across even more students. And you can see that the cost effectiveness increased substantially to almost 23 years gained per $100 spent. But one other point I want to highlight when thinking about pilot versus scale is that in these particular instances, yes, the cost effectiveness increased substantially in the case of Kenya and somewhat in the other cases, but that doesn't always have to be the case. So in some cases, you might be trying to reach more people in more remote areas. And so the cost per reaching an additional participant might actually increase, and you might see that the cost effectiveness doesn't necessarily improve substantially if the costs are increasing as a result of targeting these participants in more remote areas. Similarly, as Caitlin alluded to, if you change implementers, you can think about the cost effectiveness changing as well, and I'll touch on this in a little bit more detail as well. And similarly, if you're increasing the participants or the number of participants substantially, then you can also imagine that some of the costs that were fixed in the initial pilot phase might become variable. So in an education program, you can imagine that if you were suddenly delivering this program to a substantially larger number of students, you might need an additional school, which would add quite a lot in terms of costs. And you can imagine that the cost effectiveness might actually drop briefly as a result of that. And so I just wanted to highlight kind of the fact that when you're scaling from pilot to scale, that makes a huge difference in the cost effectiveness. And it's important to think about kind of how these considerations play out when determining whether it's going to be more or less cost effective than in the pilot. And in addition to scale, context can also drive changes in cost effectiveness. So what you're seeing in front of you is a graph that highlights the cost effectiveness of a number of different programs that each aim to increase student participation in schools. That said, you'll note there are a few programs that are also marked with stars, and the stars indicate that there were positive impacts on multiple outcomes. So for example, the cash transfer programs, a lot of them also, in addition to improving education outcomes, also had implications for health. But because we're doing a comparative cost effectiveness analysis, I'm just highlighting kind of the impact on additional years of education per $100 spent. And so going back to that first slide, these are all retrospective analyses, right? These are all the cost effectiveness of these programs as they were actually implemented in these different contexts. But these analyses can also inform prospective analysis. So you can see that each program was implemented in a particular country or in a particular context, but it's important to remember that you can't just kind of take that cost effectiveness of the program at face value and assume that if you were to implement it in a different context, it would be equally cost effective or even that the costs would stay the same. You have to do a little bit more analysis and digging to kind of come up with a much more accurate and usable prospective estimate. So for example, you can take this program that I've highlighted here on vitamin A supplementation. One big consideration is that unit costs vary so much across contexts, right? In India, where this program was implemented, it led to a 2.6 additional years of education per $100 spent. And so I think a policymaker could look at this graph and consider implementing this program in their context because it was pretty cost effective. But one big consideration is that labor costs are going to be really different, right? The cost of actually hiring people to go about distributing vitamin A in India is going to be very different from like let's say Peru or a totally different context. And so it's important to think about kind of the implications on unit costs when thinking about adapting a program to a new context. And it's not just about unit costs either. Costs can also vary across implementing organizations, as Caitlin kind of alluded to. An example of this is the program that you see highlighted here from the Dominican Republic. It provided information on the returns to education, and it was implemented by an NGO, and as you can see here, yielded about 0.23 years of additional education for every $100 that was spent. But you can also imagine that if this had been implemented by a government rather than the NGO, they might have already had their own training spaces. They might have already had their own trainers, and that would have reduced kind of the additional costs that the NGO had to spend in order to implement the program. There might have also been returns to scale. There might have been lower fixed costs, and so the program may have actually been more cost effective had it been implemented by a different actor. And the same considerations come up when it comes to infrastructure needs. So again, in the DR case, the major cost driver for this particular program was household surveys that were conducted to understand the returns to education. And then that information was conveyed back to the participants. But in a context where this approach is led by the government, they may have already had administrative data on the returns to education, and so household surveys wouldn't have been necessary, and you can imagine that the cost would have dropped substantially, and the cost effectiveness would have risen as a result. Similar issues also come up with cash transfer programs, right? They're really widespread, they're often really effective, but the cost of the transfer can vary widely depending on the local infrastructure. So one example is if you're transferring cash in a country with a digital system or mobile money, that's a very different conversation or consideration than if you have to actually physically go about distributing actual cash to people. And Sam will discuss this in a lot more detail in the following presentation, but just another really important thing to keep in mind when thinking about adapting programs across contexts. So all that to say, I just wanted to make this point that making inferences based on comparative cost effectiveness analysis can be really useful and effective, but it first requires really careful thought and consideration about how the unit costs can change across from pilot to scale and across contexts. And that's why when doing this kind of analysis, it's also really important to use a standardized methodology with real common assumptions across programs, and also to be as transparent as possible about that methodology's assumptions. And that's it. Thank you, everyone.
Thanks so much, Anu. Okay, on to Sam. We've still got hopefully a little bit of time left for some questions at the end. Okay. Sam Fishman manages the Technology for Development portfolio at the Center for Effective Global Action, or CEGA, which includes the Development Impact Lab. He also manages CEGA's Data Science for Development work and supports CEGA's Cost Transparency Initiative, where he runs the Costing Community of Practice. He's worked to support high quality and policy relevant research around the world since 2015 and joined CEGA in 2019. Prior to joining CEGA, Sam worked on cost analysis and impact evaluations at SIEF and at Innovations for Poverty Action, IPA. Sam?
Thanks so much, Doug. Can everyone hear me and see my presentation?
Yes.
Great. So yeah, I'm going to be zooming out a little bit here and talking about cash benchmarking. We included this presentation, I think, because it's important to take a broader look at value for money and look at kind of this innovative approach that to doing this. Cash benchmarking essentially is a way to think about the broader trade-offs that an organization might make in investing in different types of development programming. So what is cash benchmarking? Cash benchmarking essentially asks the question, what would happen if you took the money per beneficiary spent on some type of in-kind development program and gave it to the beneficiary, the same amount to a beneficiary in cash. Broadly, this can be used as a benchmark by which to evaluate programs. It's similar. The concept is similar to a few other and is inspired by a few other types of benchmarks used in other sectors. For example, standard of care in health. If the healthcare provider meets the test that he provides a similar level of care that a minimally competent healthcare provider would have done in a similar situation or the same situation, and given the same resources, then he meets that, or he or she meets that benchmark. And in the finance world, an index fund is maybe an even more commonly used comparison to cash benchmarking or inspiration for cash benchmarking. Managed stock portfolios or investment portfolios are costly to people who invest in them because of that management fee and have to justify that they can do better than the broader market. And an index fund is a good benchmark for whether that extra cost is worth it. Paul Niehaus talked about A/B testing foreign aid in an article he wrote about cash benchmarking in 2017. It's kind of just the idea that you could use cash not as a replacement for aid or philanthropy, but as a way, basis for comparison. And the intuition here is essentially that the complexity of many programs involves a high opportunity cost, both in a lot of the things that our other presenters have talked about in overhead and in management and the various costs of implementation, both financial and economic, and that many development organizations would do well to think about these opportunity costs, and cash might be a convenient way for doing this. So why is cash a convenient way for doing this? It's scalable. It's easy to set cash transfers at different sizes, and that makes it possible to run the kind of evaluations that look at cost equivalence. Or when I say cost equivalence, I mean essentially the same amount, the same size cash transfer to the per beneficiary cost of the in-kind program or the development program you're benchmarking against. Cash transfers also have low perceived paternalism. This is convenient from a benchmarking perspective because they're similar to how management costs suggest a different benchmark of cash might work. The paternalism or the fact that you're coming into a complicated environment and suggesting a solution. There's a lot of momentum around, maybe providing more local control over what those solutions might look like. And so benchmarking against cash is attractive for that reason. Growth of mobile money has really eased the implementation of cash, though, as Anu mentioned, it hasn't eliminated implementation challenges. Costs can vary for cash implementation as well, but mobile money has definitely made it a lot easier. And the effects of cash, the last one's maybe the most important. Effects of cash are really well documented at this point, and a lot of the outcomes that cash affects are shared in common with other types of interventions: consumption, nutrition, asset ownership, and this makes cash a convenient basis for comparison, both because of the body of evidence around it and the types of outcomes it usually has affected in across that body of evidence. So some limitations. It's not always appropriate for solving market failures, or cash is not always appropriate for solving market failures, and therefore it's not always the right basis of comparison for programs that might have different outcomes or that are trying to solve specific bottlenecks. You can still potentially explore those market failures, though, through a cash benchmarking exercise, but you might discover that cash is not the quite right solution or right basis for comparison. Cash can be, or cash benchmarking, rather, can be difficult to implement in some circumstances. You know, I'll get into the cash benchmarking work we're doing with USAID in a moment, but you know, one of the challenges here is that it took there's a lot of expertise that were involved in this, and there were large-scale RCTs to kind of build up the evidence base we needed to think about doing cash benchmarking at a wider scale. And this last point is not as specific to cash benchmarking, but there are many broader kind of challenges to cost effectiveness type evaluations. You know, there's a lot of work now being done to try and think about equity across cost effectiveness studies, but it's still they're still often not considered. Time scale, one of the studies that I'll go over is looking at a relatively long time scale compared to other attempts to do this, but it's still the effects of cash across a longer time scale are less well understood. Operational scale, sustainability, I think people are familiar with these challenges. And I added this last point as Anu was presenting because I didn't want to miss it. There can be implementation of cash across contexts can vary. So don't think of cash as perfectly clean and the same everywhere. There are plenty of challenges there as well. So really quickly want to get into what we're working on with USAID. So a few years ago, you know, USAID got interested in actually trying this approach and invested in 5 cash benchmarking studies across 4 countries. And many of these studies are still underway, but we've already gotten evidence from our studies in Rwanda, and you know, I think we're basically have shown that this is possible. It is possible to take an in-kind intervention and benchmark it against a cost equivalent transfer and generate cost equivalent comparisons. So I'm going to really quickly get into just one of these studies, the Huguka Dokore Workforce Readiness Program in Rwanda. This program was pit in a head-to-head kind of comparison RCT with cash, and there was significant randomized variation of the cash in this study, which really allowed for a rich set of comparisons. And I think that's part of what really makes this study stand out. You know, there's you might find that cash, you know, does better than an in-kind intervention at the cost equivalent level, but it's important to look at a wider set of cost effectiveness comparisons. For example, in this study, you know, a slightly larger cash transfer proved was actually the most cost effective. And you know, this is, if you just look at the cost equivalent amount, you kind of miss out on these broader kind of trade-offs that policymakers could be considering in their value for money kind of assessment of cash versus other programs. And this is also, you know, going to be a long-term relatively long-term study. We're going to follow up, or Craig McIntosh, who's the PI in the study, is going to be following up in 36 months. So we should get some good ideas, you know, how this works across a longer time horizon as well. I think I'm running out of time, so I'm going to try and wrap up as quick as possible. So what are our aspirations here? We really want to be able to do this at a larger scale, and we're starting to look at ways that you know, you could simulate the benefits of cash transfers across contexts and at various sizes. And we're hoping that this can, you know, provide a model for organizations like USAID to benchmark, you know, other programs across these sort of imputed cash transfer values. And more broadly, I think this approach really has a lot of potential to get policymakers and program managers thinking about the opportunity costs of their programs. There's, again, the just scale of evidence on cash transfers at this point, and some of those other benefits to implementation, and really make this an attractive way to start thinking about what the trade-off is in implementing complex programs that might that have similar impacts or outcomes to cash. So really quickly to wrap up, this is really just a little primer. We're going to have a big discussion about this tomorrow at our Costober event, and we really like to see all of you there. And we're going to have Craig McIntosh, the PI on our Rwanda studies, Paul Niehaus, who really helped get this all started, and Florence Kondilis at the World Bank, Joe Amick at USAID, who helps manage our cash benchmarking portfolio, and Liz Brown moderating. So hope to see you there, and I'll share the link in the chat.
Thanks so much, Sam. We're just over time. I just want to give a huge thank you to Alaka, Anu, Caitlin, Sam, Christine, and Liz. Excellent questions and contributions. Thanks so much to everyone for joining the panel, and look forward to seeing you all in the other What Works Global Summit sessions. Thank you.
Thank you.